New numbers show people of color are still falling behind when it comes to getting vaccinated for COVID-19.
A report just released yesterday by the CDC shows 65% of people who've gotten at least one dose so far are white, while Latinos, Native Americans, Asians, and Black people each make up less than 10%. We want to bring in Tiffany Cross, host of The Cross Connection on MSNBC. Tiffany, thank you so much for joining us this morning for this important conversation. Now, it's been several months since the rollout started, and we now have 3 vaccines, with Johnson & Johnson's just hitting the market this week. A bigger supply, more places to get the shot, but it doesn't seem like that's helping Black people and other people of color get vaccinated. Why is that?
Well, there are a few reasons. One, I want to honor and respect people's distrust in the medical community, which we've talked about, but that is not the only reason. But I do at least want to start with that. Let's take a listen to a healthcare worker, Felicia, who talks a little bit about that.
We have good reason to be afraid. We have good reason when we hear something like, oh, it's warp speed, the first thing that hits our mind is, oh, really?
We are standing firm against COVID. We just have concerns as far as that go when it comes to the vaccine. And of course, I would not take it. I'm not yet convinced that this is safe at this point for our people. It is our right also to say we want to wait to look to see.
All right. So you hear a lot of distrust in the community, which is certainly warranted given the history of this country. However, that is not the only reason. I think a huge reason for communities of color is access. So when you look at the disparity rate between who has gotten this vaccine, that rate is half of Black Americans when compared to our white counterparts. And when you look at that disparity rate with the Latino community, it's even larger. So you think about how you have to go about getting this. You have to navigate the internet, and you have to plan your vaccine as we partner with the administration at NBC Comcast to do that. But there are also challenges in terms of physically getting there. So you think about elderly people who might live in rural areas when the pharmacy that's closest to them is 20 minutes away. They have to take public transportation. They can't get an appointment. You think about frontline workers who may have, transportation issues, financial issues. I think there's this misguided concept sometimes when you're trying to appeal to these communities, like, oh, let's go out and find celebrities, let's find these, validators that will get people to take it. And the truth is, the issue is access, not always hesitancy. My mother lives in Maryland. She had challenges trying to figure out where she could get her vaccine. I have colleagues who are working with their elderly parents. And even I live in Washington, D.C., and it is not so easy trying to gain access. I also do want to point out really quickly, guys, that they are throwing away hundreds of doses at some locations in different areas. So you look at the Bible Belt. I have friends who work in pharmacy there who tell me that people are refusing the vaccine or people don't know that it's there. So every night, hundreds of vaccines are being tossed because the vaccines that they have to be used once you take them out of the freezer. So this is something that I think is going to take a long time. I think a PR campaign would help. You got to see these posters on bus stops and having local community validators and having people and trust get the vaccine, and that will help spread the word responsibly.
Tiffany, we've reported on outreach efforts in communities of color, including turning Black churches into vaccination centers. Tell us more about those efforts, and are they making a difference?
So I think that's also a very good idea with Black churches, but we have to be careful in using, antiquated notions about the Black community. It's a very diverse community. So there are some people who never sit in a pew on Sunday mornings and who don't have a church home, and they congregate in digital spaces, So I think that we are seeing slow improvement. I think more and more people are trusting the vaccine. I'll tell you guys just anecdotally on my timeline, it's become somewhat like a point of privilege, when people post a picture of them, got my first shot, got my second shot. And I think those things do help because it's not that it's a celebrity, but it's someone that they know and they trust, and they see that person getting vaccinated. So again, the huge key here is access. Our colleague, Dr. Jason Johnson, who's a MSNBC contributor, he tweeted about being in LA and the location where he got his shot. He found out they had an excess of 600 doses that day. Wow. But they weren't all used. You also have issues in impoverished neighborhoods wealthy white people coming in those neighborhoods in line because they know how to navigate the system, where people who are disproportionately impacted, Black and brown folks, don't. And so they're getting left out of the vaccine process. So again, access is key. Information campaigns are key, meeting people where they are. Not everyone is watching, cable news outlets. Not everyone is streaming, news verticals. And so, put some folks on the shade room, have some people talk to Charlemagne, have people on your local radio station, find people where they are, cast a wide net of information sources and make it user friendly. And I think you will continue to see these numbers go down in terms of COVID cases and numbers go up in terms of vaccination. I'll tell you guys, I did commit to filming myself for the network when I get my vaccine. So stay tuned for that.
Oh, yes. Okay, great. Well, hey, that's a tease. And we've heard it doesn't hurt, so hopefully it's no big deal. Now, Tiffany.
We hope. Yeah. We hope.
Tiffany, you've mentioned this and you've very eloquently explained that there's these two issues we keep coming back to, the access to the vaccine, but also the hesitancy. You've also just laid out some phenomenal ideas about how to address these things. But how can doctors who are face-to-face with patients who might be hesitant, or health officials, or the media, you mentioned things like a PR campaign or getting people in different places to meet them where they actually are consuming content. How can those things actually address those dueling concerns?
Yeah, so even in the medical community, having diverse people, carry this message, but also even if it's not a diverse medical community, having people go to diverse places. So you look at Dr. Fauci, for example. Dr. Fauci is universally trusted in all communities. I will tell you, I'm from Atlanta and I have friends in Atlanta, and they don't say, did you get the Pfizer vaccine? They say, did you get that Fauci? Everybody wants the Fauci vaccine because they think he's the voice of trust and reason. So I think having doctors speak to the people, they're talking to on their level. Even, when I go to the doctor and sometimes they talk very medical speak, I think this is true the same in politics, where you can have a conversation and say, oh, well, we're waiting for numbers from the OMB and, the DOJ is going to do this. And not everybody knows the alphabet soup that makes up DC. The same is true in the medical community. So when you have this very highbrow medical inside baseball speak, that flies over some people's head. And sometimes you just have to make it plain. What I tell people is explain it to me like I'm a 5-year-old, because then there's no room for confusion after that. And people have very legitimate questions around it. And so, I think we're seeing some of that. I'll tell you guys, we have Dr. Chris Purnell on my show this weekend, this Saturday, and we've had her on a few times where we just ask plainly the questions people want to know. I tweet out, send me your questions, and people have questions like, well, should I get the vaccine now that the variants are out? I don't know if that's going to work, or I'm pregnant, can I get the vaccine? And I know it seems like these messages are being driven over and over and over, but it only seems like that from the people delivering them. The community on the receiving end needs to be exhausted from hearing this message, and we're not there yet.
Tiffany, so great to have you on this morning. We really appreciate it. And thanks for everything and all your reporting.
Absolutely.
It was awesome. Please invite me back. I love
We will.
Anytime.
Invitation is out there now already.
Thank you.
Thanks, guys.
And we do want to continue this conversation now with Dr. Robert Fullilove. He's the Associate Dean for Community and Minority Affairs and Professor of Clinical Socio-Medical Sciences at Columbia University. That's just the beginning of your impressive resume. You're a third-generation doctor. Your grandfather treated patients during the 1918 pandemic. You yourself treated AIDS patients during the crisis in the 80s. And recently you've worked with Dr. Fauci, who we were just talking about there. So what is your take on the racial inequities that we are seeing when it comes to getting this vaccine?
Well, I think your previous presenter had it right. I think we live in a country that has never really structured healthcare so that it could serve communities of color, especially poor communities of color. So what we're looking at are decades, literally, of neglect, where access to healthcare services and access to the things that will provide people with good health simply have been lacking. Now that we have a pandemic that's taking advantage of all of the conditions, the chronic disease conditions that are in our communities, from hypertension to obesity, we're suddenly seeing that the chickens have come home to roost. Our inability to deal with these problems in the past is now haunting our efforts to control this pandemic in the present.
Doctor, in addition to that long list of qualifications and things you've done in your life that Joe just said, you also worked for John Lewis during the civil rights movement. How does vaccine access intersect with civil rights here?
Well, more than anything else, I think the civil rights movement was correcting inequities that existed in the system that were there by law, either whether de jure or de facto. And we saw that those inequities were hugely remedied when suddenly we passed laws that outlawed any form of discrimination. Now we're in a situation where it's not so much law, it's practice. It's an inability to serve the needs of communities of color. That means that all the efforts we're trying to mount to make sure that residents of those places are being cared for, we're suddenly discovering that we don't have the machinery, we don't have the equipment, we don't have the contacts, and we don't have the necessary community connections, as your previous presenter noted, that would allow us to facilitate any effort to really do the job to control this pandemic. We've got to work now with community-based organizations that in the 1980s and in the 90s were working with HIV/AIDS because this viral pandemic is hitting the community in the same way that HIV/AIDS did 20 years ago.
Dr. Fullilove, great to have you on this morning. Thank you so much for your perspective and your expertise. We really appreciate it.
Yes, thank you.
Pleasure was mine. Thank you for having me.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.